In the former Soviet Union, where MSF has seven projects in 7 countries, we are seeing rates consistent with what's been reported in the recent WHO report, where there are many countries that have more than 20% of new TB cases are MDR TB. And what we see in our programs is that actually there are many hotspots within those countries where the rates of MDR, multi-drug resistant TB, are actually much, much higher. Many of these patients are actually treated by being admitted to hospital for many months at a time. And we think this is a bit unfortunate because there is now actually very good evidence that there are community-based models that are not only feasible but as effective, if not more effective, than starting treatment in hospital. And that's a little bit of good news for countries because actually starting treatment for drug-resistant TB outside of hospitals is actually cheaper, is actually safer in terms of reducing risk of transmission of drug-resistant TB in hospitals. And most importantly, it actually reduces waiting lists. Our experience has shown that by admitting patients to hospital as the only way to start drug-resistant TB increases your waiting lists. And I was recently shocked when I read the WHO report that was just released, where despite the good news of an increased number of people being reported as diagnosed with multi-drug resistant TB, 1 in 4 of those people was actually put on a waiting list rather than got treatment. So that's a huge number of patients waiting for the right treatment, and while they're waiting, they get sicker and their outcomes are going to be worse. So if we actually look a little bit more in detail from the big numbers that were reported in the WHO report, we can kind of boil it down to one number. If you were diagnosed with multi-drug resistant TB in 2013, what was your chance of actually getting diagnosed as having multi-drug resistant TB, getting put on the correct treatment, and then we can project going through all the way to getting cure? At best, it's about a 1 in 8, which I think is really a shocking indictment of where we are, given that we have nearly 2 decades of experience of treating multi-drug resistant TB in resource-limited settings. Let me tell you about my own personal experience. I was recently in a country in Central Asia, and I saw a 4-year-old child who had been sick for a number of weeks. And this child actually was fortunate enough to be one of the first children in that country to be diagnosed with multi-drug resistant TB and get access to treatment for a child with multi-drug resistant TB. But I stopped for a moment and I was reminded that how did this child get multi-drug resistant TB? It's because they were living in a house with an adult who had multi-drug resistant TB. This is a case of primary transmission and at an individual level highlights what is happening and becoming the new normal for TB in many of these countries, where primary transmission and the growth of the epidemic is becoming more of a concern. I think this case for me highlighted what we see at a program level, where we can see that MDR TB is an epidemic where the horse has bolted out of the stable and programs are running to try and catch up. The thing that was even more shocking for this child was that actually this child had extensively drug-resistant TB. That's TB that's even harder to cure with the current drugs that we have. In fact, the outcomes that have been reported from 2011 in the recently released WHO Global Report showed 22% success rate for treatment of extensively drug-resistant TB. Stop for a moment. Think about that, 22% success. That's a really long, difficult to take, expensive treatment, and you've got a 1 in 5 chance of cure. In the former Soviet Union countries where we work, many of the countries have more than 20% of extensively drug-resistant amongst the MDR TB cases. So this is not an isolated problem for a few people. This is becoming a bigger problem. How can we read this number and not urgently demand more treatment? Now, I want you to do a little thought experiment with me, if you will. Just imagine yourself that you're in one of these countries and you see a patient who has extensively drug-resistant TB. You're the healthcare worker in front of that patient. That patient has been to see many other healthcare workers, And now that patient, who is in the minority globally, is the lucky patient who actually has had access to the right tests to not only diagnose drug-resistant TB, but to be able to diagnose extensively drug-resistant TB. So this lucky patient gets to sit in front of you as the healthcare worker who is up to date with your knowledge. You've read the recent WHO guidelines updates. You've read the WHO guidelines about how to use these new drugs, these 2 new drugs that have come onto the market in the last 2 years, bedaquiline and delaminid. So you know the evidence. Now, imagine what you have to tell that patient, because actually you have to explain that those drugs are not available in the country that this patient lives in. Those drugs are not included in the national policies that this patient is living in that particular country. So now you have to explain that although there are better treatments available, I'm sorry, but you only have a 1 in 5 chance of success, and you're still going to have to take treatment for more than 2 years with a lot of drugs that have a high chance of causing you side effects, because you're going to have to take drugs that are basically 50 years old. So what I hope that these stories have highlighted is the gaps between the evidence and the international policies and what we're seeing in the national policies and what's implemented on the ground. I think what we need to do is we need more urgency to demand change in the policies at national level and to provide assistance to countries on how to do that with best practice from other countries who have already started on this journey. I think we also need to urgently scale up access to the new drugs, and bedaquiline has now been available on accelerated access for nearly 2 years, but it's not available in the majority of countries where we work, which is highlighted in the report. And then finally, we need to call for more urgent research into not just new drugs, but actually new regimens that work.